What if a simple change on your skin, a new spot, a patch of dark skin, or a sore that just won't heal, could be an early signal of a health issue affecting millions of people, often silently? Consider this. Based on the latest CDC data, about 14.7% of adults in the United States have diabetes. But what's really concerning is that for about 3.4% of all adults, their condition is completely undiagnosed. That translates to millions of people living with a serious metabolic disorder, totally unaware of the damage it could be doing to their heart, nerves, kidneys, and eyes. Many of those first clues of diabetes appear right on your skin. Recognizing these signs for what they are, early warning signals, gives you the power to take control, ask questions, and make changes that can protect your health for years to come. Welcome to the channel. I've been a doctor for over 15 years, and here are the 7 of the most important skin signs of diabetes you absolutely shouldn't ignore. We'll explore what they look like, where they tend to appear, and most importantly, why they happen. This knowledge is your first line of defense. By the end, you'll be better equipped to spot these signals, not just on your own body, but maybe even on a loved one, giving them the chance to act early. If you do find this information helpful, please do consider subscribing so this video can help reach more people. First up is one of the most well-known and distinct signs of an underlying metabolic issue: Acanthosis nigricans. You might have seen it without knowing its name. It shows up as dark, thickened, and often velvety-feeling patches of skin. Many people mistake it for dirt they can't scrub off, but it's a physical change in the skin itself. These patches typically appear in the folds and creases of the body. The back of the neck, the armpits, and the groin are the most common spots. The texture is key here. It's not just a change in color. The skin feels thicker, softer, and almost like velvet. So what's causing this? Acanthosis nigricans is a direct sign on your skin of high insulin levels, a condition called hyperinsulinemia. In prediabetes and type 2 diabetes, your cells become resistant to insulin. Your pancreas tries to compensate by pumping out more and more of it. This flood of excess insulin can overstimulate your skin cells, telling them to multiply way too fast. That rapid cell growth is what creates the thickened, dark, velvety patches. Think of it as your body's internal messaging system going a little haywire. The extra insulin is like a constant shout, ordering skin cells in certain areas to grow, and Acanthosis nigricans is the visible result. It's so strongly linked to this process that clinical guidelines from groups like the American Diabetes Association consider it a major red flag for insulin resistance. If you see this sign, it's not just a cosmetic issue. It's your skin sending a clear signal to get your blood sugar and insulin levels checked. Next on our list is something incredibly common: skin tags. These are those small, soft, flesh-colored growths that often hang from the skin by a little stalk. You usually find them where skin rubs against skin, like the neck, eyelids, and armpits. For many people, a few skin tags are just a normal part of life. However, we're not talking about 1 or 2. The indicator here is the development of multiple skin tags. If you suddenly notice a bunch of new skin tags popping up, it's time to pay attention. While the connection is still being studied, some research has shown a link between having numerous skin tags and an increased risk for type 2 diabetes. What's the connection? Much like with Acanthosis nigricans, the driving force is thought to be insulin resistance. High levels of insulin and other growth factors in the blood may act as a stimulant for skin cell growth, causing these small, benign growths to form. It's a numbers game. While a single skin tag isn't a cause for concern, a sudden increase in their number can be a subtle clue. It's not a definitive sign on its own, but if you notice a lot of them appearing, especially with other signs on this list, it's a good reason to talk with your doctor about screening for prediabetes. This next sign is one of the most serious and requires immediate attention: sores, cuts, or blisters that heal extremely slowly. A small cut that would normally be gone in a week instead lingers for weeks or even months. These non-healing wounds, especially on the feet, are a hallmark complication of unmanaged diabetes. The reason for this is a devastating 1-2 punch caused by high blood sugar. First, it leads to poor circulation. High blood sugar damages the lining of blood vessels, causing them to become stiff and narrow. This dramatically reduces blood flow, especially to your feet. Healing requires a steady supply of oxygen, nutrients, and immune cells to the wound. When circulation is bad, it's like trying to send emergency supplies down a blocked road. The wound is starved of what it needs to repair itself. Second, high blood sugar causes nerve damage, or diabetic neuropathy. This is incredibly dangerous because it can lead to a loss of sensation. You might not even feel a small pebble in your shoe or a blister forming on your heel. An injury that would normally cause pain can go completely unnoticed. This combination of not feeling the injury and the body's inability to heal it creates a perilous situation. A simple, unnoticed blister can turn into a deep open sore called a diabetic foot ulcer. These ulcers are a major cause of serious health problems and are a leading risk factor for lower limb amputations in people with diabetes. Any wound, particularly on your feet, that is taking too long to heal is a critical warning sign that warrants an immediate visit to a healthcare professional. Have you ever noticed faint, light brown or reddish spots on your shins and just dismissed them as old scars or age spots? This could be a condition known as diabetic dermopathy, often just called shin spots. It's considered one of the most common skin findings in people with diabetes, with some studies showing it occurs in up to 30% of patients. These spots usually appear on the lower legs. They often start as reddish, scaly patches that eventually flatten out, sometimes creating a slight indentation in the skin. A key feature is that they don't typically itch or hurt, which is why they're so easily ignored. So what causes them? Diabetic dermopathy is believed to be a direct result of damage to the small blood vessels that supply the skin. Chronic high blood sugar damages these tiny capillaries, causing them to leak. The brownish discoloration is thought to come from small amounts of blood leaking out of these damaged vessels, similar to a bruise. While the spots themselves are harmless, their presence is significant. Studies have shown that people with these shin spots are more likely to also have other microvascular complications of diabetes, like retinopathy, eye damage, nephropathy, kidney damage, and neuropathy, nerve damage. Think of it as an external marker for internal damage. The same process causing these spots on your shins could be affecting the tiny blood vessels in your eyes and kidneys. Our fifth sign is all about your body's defenses. Are you constantly battling infections, particularly fungal ones? This could be another important clue that your body is dealing with high blood sugar. People with diabetes are more susceptible to infections in general, but fungal infections caused by yeasts like Candida albicans are especially common. These infections love warm, moist areas of the skin. You might experience an itchy red rash in the armpits, groin, under the breasts, or between fingers and toes. For women, this can mean frequent vaginal yeast infections. The link is twofold. First, yeast and fungi feed on sugar. When your blood glucose is high, the sugar content in all your body's fluids increases, creating a perfect environment for these organisms to thrive. Your skin essentially becomes a welcoming buffet. Second, uncontrolled diabetes can weaken your immune system. High blood sugar impairs the function of your key immune cells, making it harder for your body to fight off an infection once it starts. So, if you're constantly fighting things like athlete's foot or other rashes that don't clear up with normal treatment, don't just treat the symptom. It's a well-known sign that your body might be dealing with elevated blood sugar, and it's time to investigate. This next sign is dramatic and often appears quite suddenly, acting as an urgent alarm bell. It's called eruptive xanthomatosis. It shows up as a sudden outbreak of firm, pea-sized bumps on the skin. These bumps are typically yellow, but are often surrounded by a red halo and can be tender and itchy. They most commonly appear on the backs of your arms, the fronts of your legs, and especially the buttocks. What causes such a dramatic reaction? Eruptive xanthomatosis is a direct result of extremely high levels of triglycerides, a type of fat, in your blood. When diabetes is poorly controlled, the body's ability to process fats is severely impaired, and they can build up to dangerous levels. When that happens, the body tries to clear the excess fat by depositing it in the skin, forming these waxy yellow bumps. The appearance of these bumps is a sign that your diabetes is likely severely uncontrolled. The triglyceride levels needed to cause this are often high enough to put you at risk for acute pancreatitis, a painful and potentially life-threatening condition. The good news is that once the underlying high blood sugar and triglycerides are treated, the bumps usually clear up. But they are an unmistakable warning that you need immediate medical attention. Our final sign involves a cluster of symptoms related to nerve damage, or diabetic neuropathy. While we often think of neuropathy as numbness or tingling, it also has visible effects on the skin, especially on the feet. One of the most common signs is extreme dryness, called xerosis. This isn't just your typical winter dry skin. It's a severe dryness that can cause the skin to get rough, scaly, and crack, particularly around the heels. This happens because diabetes can damage the nerves that control your sweat and oil glands. When these nerves don't work correctly, the skin on your feet loses its ability to stay moisturized, leading to severe cracking. These cracks, or fissures, are dangerous. They create open gateways for bacteria, increasing the risk of infections and foot ulcers. This is made even worse by the more well-known sensory symptoms of neuropathy: numbness, tingling, or burning pains. The loss of protective sensation is incredibly risky. You might step on something sharp or get a blister and be completely unaware of the injury. This combination of extreme cracking dryness and a loss of sensation is a recipe for disaster. If you notice your feet becoming exceptionally dry and cracked, or you experience persistent numbness, it's a powerful signal that high blood sugar may be taking a toll on your nerves, and it's time to seek medical advice. So let's recap. 7 warning signs from your skin that could point to diabetes or prediabetes. We've talked about the velvety patches of Acanthosis nigricans, multiple skin tags, slow-healing sores, diabetic dermopathy or shin spots, frequent fungal infections, the sudden bumps of eruptive xanthomatosis, and the dry, numb skin from neuropathy. Your skin is an incredible mirror of your internal health. These signs aren't just minor cosmetic issues. They are vital messages from your body that something is out of balance. The purpose here is not to cause fear, but to encourage you to be proactive. Seeing one of these signs doesn't automatically mean you have diabetes, but it absolutely means you should investigate. Early detection is your most powerful weapon. We know from major studies that for people with prediabetes, a structured lifestyle change program can cut their risk of developing type 2 diabetes by an incredible 58%. And that figure jumps to 71% for those over 60. That is the power of catching it early. Don't wait for more severe symptoms. Listen to your body's earliest warnings. Listen to your skin. Your health is your most important asset. If any of the signs we talked about today seem familiar, the most important step you can take is to schedule an appointment with your doctor or a dermatologist. Tell them what you're seeing and ask if you should be tested for diabetes. A simple blood test is all it takes to get answers. Taking that step puts you back in the driver's seat of your health journey. If you found this video valuable, please help us spread this crucial information by hitting the like button and subscribing for more health content. And most importantly, share this video with your friends and family. You never know whose life you might change by helping them spot a warning sign and take action. Thank you for investing this time in your health. Be aware, be proactive, and take care.